The intensive care unit, part of the intensive medicine department, has been located in the north wing of the first floor since 2020. It also extends into the west wing. This unit provides care for patients who, while potentially recoverable, require advanced respiratory support. It also admits patients who need basic respiratory support in combination with support for at least 2 other organs or systems. Likewise, complex patients experiencing multi-organ failure and requiring organ support are managed here. The intensive care unit can also accommodate patients who require a lower level of care but still need close monitoring. The unit is composed of 2 interconnected areas joined by a corridor. The north wing consists of both open and closed cubicles, the latter designed to allow for full isolation of patients who require it. This area also includes a pharmacy section for the storage of medications, intravenous fluids, and wound care supplies. 2 storage rooms with equipment and consumable supplies, one of which is exclusively for respiratory equipment. A staff lounge for all staff members equipped with a telemetry monitor. A room designated for medical personnel, also equipped with telemetry monitors. The west wing is likewise composed of both open and closed patient cubicles. In addition, this area includes a pharmacy section with less capacity than that of the north wing, where medication is prepared and stored. An open storage area for containers and equipment used in the enteral nutrition, as well as for wound care supplies. A dedicated storage for tubes and other medical supplies. A small storage room is allocated for equipment and consumable materials used in hemoinfiltration. A staff lounge is available for personal use. A workspace equipped with computers where the medical records of patients admitted to the unit are stored. During a standard work shift, the first task is to conduct the handover, sharing the most relevant information regarding the patient's condition and clinical progress. This is followed by a review of the nursing notes from previous shifts and the medical progress report. Based on this information, patient care and nursing interventions are planned. Subsequently, the prescribed treatment for admitted patients is reviewed using the ICCA and García care software systems. Vital signs must be monitored at least every 2 hours, along with other physiological parameters such as pupil size and reactivity. Additionally, closer surveillance is performed for patients who require it, particularly those in neurocritical condition, or for those patients receiving mechanical ventilation or undergoing continuous renal replacement therapy. All patients' medication are administered at the scheduled times and whenever clinically indicated. During the morning shift, patient hygiene becomes particularly important, an activity that often requires collaboration from the multidisciplinary team due to the complexity of physically managing those patients. Hygiene must be performed carefully and systematically, ensuring continuous monitoring of vital signs and verifying the secure connections of all medical devices in use. Once the medical team has examined the patients, they inform the nursing staff of any changes in treatment or need to carry out additional diagnostic procedures. Intravenous fluid therapy and enteral nutrition are managed during the morning shift. This time is also used to collect new data and reassess vital signs. Patients are then prepared for family visits, which take place at 1 p.m. and 5 p.m. During this shift, infusion lines and intravenous systems are also checked to ensure that they are replaced in accordance with the usage duration and expiry guidelines. The afternoon and night shifts ensure the continuity of care and treatment delivery. To guarantee readiness in emergency situations such as cardiac arrest, the emergency crash cart and its equipment are checked regularly. This is a responsibility that nursing students must also learn and become proficient in. The nursing staff in the intensive care unit, as well as newly incorporated nurses, participate in training sessions and knowledge updating workshops. Nursing students are welcome to attend these sessions as part of the complementary education. Critically ill patients require continuous care focused on meeting the basic needs that have been compromised by the pathological condition. Starting from a situation of vital compromise, the care of this type of patients shall be governed by the principles of priority, continuity, and systematic approach. Among the general care tasks for critically ill patients in which nursing students participate are participating in shift handover, to communicate the most relevant information concerning the patient's condition and progress. Planning and delivering appropriate care tailored to each patient, including various life support therapies. Completing the nursing records used in the unit. Ensuring adequate hygiene for the patient while managing the safety and performing safe mobilization where required. Ensuring compliance with isolation protocols by both healthcare personnel and visitors. Promoting patient comfort and addressing the needs of family members. The commitment to delivering high-quality, humanized care within the intensive care setting drives healthcare professionals to continue working collaboratively in service of critically ill patients. Specific and ongoing training is one of the strengths of clinical rotations and is essential to remain up to date with the latest therapies and treatments. Gaining practical knowledge in specialized care units is crucial for the future nursing professionals to perform their duties in accordance with the most current scientific and quality standards.